Thank you for the opportunity to present our work. My name is Cintia and I'm a postdoc in the Department of Surgery. Now I'm going to present our study, Small Victories, Microlearning through Animation is an effective tool in surgical education. Microlearning is an education approach in which the content is delivered in small, bite-sized units, with no more than 3 to 4 education objectives. So in microlearning, the material is broken down in small units that are easier for the learner to process. And then learning occurs through making connections between the small units, which stimulates critical thinking and is thought to facilitate memory retention. The content is usually presented in the form of short videos that are disseminated through the internet, and the use of social media is very common. The aim of our study was to determine if a short video animation could facilitate comprehension about a complex surgical pathology among health profession students. We developed a 2-minute video animation explaining the mechanisms by which rectal prolapse and rectal seal occur and how they can lead to bowel dysfunction. We posted the video on YouTube and distributed a pre- and post-video quiz among medical students, DO students, and other health profession students. We evaluated the pedagogical outcomes using the Kirkpatrick's model of learning evaluation framework, in which there are 4 levels. Level 1 is reaction, which we measure through students' engagement and satisfaction. Level 2 is learning, which we measure through the pre- and post-video quiz, and for that, we only assess the responses of students who spent at least 40 seconds on the video. And levels 3 and 4 of this framework are behavior and results, which are long-term outcomes that we didn't assess in this study. We had 115 respondents, of whom 83% were MD or DO students, and the majority of them were in the 2nd or 3rd year of school. Most of them were 25 years old or younger, and 70% reported using videos as a resource to study. The majority of them also preferred videos shorter than 10 minutes. The median time spent on the video was 40 seconds, and 81% agreed or strongly agreed that the video explained the concepts clearly. 58 respondents spent more than 40 seconds on the video, and from those, 76% went from extremely or somewhat uncomfortable to somewhat or extremely comfortable explaining the concepts of rectal seal and rectal prolapse. And 74% of these students increased their quiz scores or remained at the maximum score. In conclusion, microlearning through animation was well accepted among students and contributed to short-term knowledge retention. Limitations of our study were that we didn't assess long-term memory retention, we had a small sample size, and it was an anonymous survey, so we can't guarantee the quality of the responses. In the future, we plan to assess long-term memory retention and develop more content. Thank you for your attention, and the QR code to the YouTube video is down below.